My name is Dr. Sahil Fulara. I am a consultant endocrinologist that is specialist in diabetes, thyroid, obesity, hormone disorders. My topic, as I've already discussed about diabetes, its complications, its signs and symptoms, investigations and management. Now I'm going to be talking about how do we manage diabetes in this COVID era. Thankfully now with the Omicron coming in is not as strong as it was with the Delta variant. Definitely COVID patients do present with complaints of fever, sore throat, pain while swallowing, could be fever, cold, running of nose, headache. The good part is nowadays they don't have the earlier symptoms where people would be put on ventilators because the involvement of the lung is much lesser. In short, it is a more milder variant. But with that, I think we should not take it easy, not let down our guards, and obviously wear the mask and keep social distancing. While we talk of managing diabetic patients in COVID, I think the most foremost thing is we need to visit our doctor, and sometimes the medications need to be again channelized properly, because in COVID patients do complain, as I told you, of fever. There is a symptom where the patient can feel nauseous, feel pukish, the appetite might go down. So along with that, if there are certain medications which are potent, that means they can lower down your glucose, those medications should be lowered and the dose should be lowered. Secondly, there is certain medication in diabetes which throws out the glucose in the urine and causes glucosuria. That medication also should be avoided in patients with COVID, especially if they are having fever and if they are dehydrated, because it can lead to urinary tract infections, mycotic infections and genital infections. Thirdly, if the patient is having a high variety of say COVID, say it's God forbid the Delta variant, or if the patient desaturates and the oxygen level goes down, and for some instance the patient is put on steroids, these patients need to be put and managed on insulin. So that is very important. In short, the individualization of therapy is very important. The management needs to be seen very carefully. Along with that, the blood pressure should be under control, say around 120/80, 130/80. Along with that, stay well hydrated. Have around 2 to 3 liters of water. Have good amount of say limbo pani, and of course, if they are diabetic, one should avoid fruit juices. Coconut water is very important. So I think the carry home message is that with COVID, if God forbid you are having diabetes, please do visit your doctor. Do not self-medicate yourself.